Knock, knock, knock. I'm going to introduce myself. Hello, Mrs. Dan. My name is Shonda. I'll be your nurse. I'm going to put in an NG tube. So first I'm going to clean my hands and provide for privacy. Okay, and Miss Dan, can you tell me your name and date of birth? Alright, got the right person, right place, right situation. Alright, well Miss Dan, I'm just going to do an assessment of your stomach. The NG tube is going to go in your nose and it's going to travel down your esophagus to your stomach so that we can suction your belly. And listen. And I would normally listen up under your gown. Okay? Hearing mouth sounds. Okay. Now, Miss Dan, I'm going to take a look at your gag reflex, and I'm going to stick a tongue depressor in the back of your throat and see if you gag. So say ah. Okay. Alright, so she's got good gag reflex. And then I'm going to also just assess your nares to see if you have any nasal septum deviation, or see if the airflow in both of your nares is patent. Okay, you got good airflow there. Okay, so I'm going to go ahead, put my gloves on. Miss Dan, do you care if I set you up? I'm going to set you up semi-Fowlers, high Fowlers, to help facilitate this tube that'll go in. Is that all right? Mm-hmm. All right, so I'm going to raise your bed. Set you up. I'm going to lift you up here, okay? 1, 2, 3. Put some pillows behind your back. That way you're sitting up pretty good. Alright, I got my suction ready to go. Alright. I'm going to go ahead and prepare my irrigation tray with normal saline. Just pour so that I'm ready to go when I'm ready to irrigate. Tube. I need to measure my patient's, measure the tube so that I have the right amount of area to put this in. So I'm going to measure from the tip of the nose to the patient's earlobe to the xiphoid process, okay? And this is a clean procedure, it's not sterile, but you still want to keep in mind that this is a tube that's going to go inside your patient, okay? So from here to here. It's right there, okay? So most NG tubes have little markers there. I'm going to take a piece of tape and I'm just going to mark where that is. That way I have that marked off. I'm going to set my NG tube down on its wrapper, okay? And I'm also going to lubricate my tube. Make sure I get it all the way lubricated, at least to where the notches are, okay? I'm also will prepare some more tape. So now I've done my prep and done my assessment. Some other things I need to do is to grab 2 pieces of tape. I have one here, and then one of my pieces of tape, I want to make tape pins. So with that, you'll take a piece of tape And you're going to split it down the middle. Leave part of it halfway available. And then take one of the pants legs and just flip it over, okay? That'll keep from the two legs from sticking together when you're ready to tape it, all right? So Mrs. Dan, I'm all ready to insert your NG tube. I'm gonna hand you a cup of water so that once I get the tube in, I'm gonna ask you to take sips of water to help facilitate the tube so that it goes in your esophagus and not through your airway and travel to your stomach. Does that sound okay? You understand? Okay, all right. So, grab my tube. I've already measured, okay. All right, so I've decided to use the patient's left nair, all right. So you're gonna feel a little discomfort, okay? All right, I'll tell you when to take the glass of water and start swallowing. All right, here we go. Okay, once I get it towards the nasal pharynx, or you will feel a resistance, I'm gonna have the patient flex their neck. All right, Mrs. Dan, I need you to take some drinks of water, okay? And I'm gonna go ahead and push this in. I'm checking to make sure the tube is not going in, coming out of her mouth. I'm also checking for chest rise and fall, make sure she's breathing okay, she's not getting anxious, not getting cyanotic. And if you have a little difficulty, you can twist it. Okay, and I'm at my measurement mark. All right, we're all done. You did good. Okay, so I'm gonna just hold that there. And I'm gonna go ahead and secure my tube with my tape pants. And so what you'll do is lay the tape on the bridge of the patient's nose. And then wrap your legs around your tubing. Your tape around your tubing, sorry. Doing okay? All right, she's breathing okay, the tube's in. All right, so I need to assess that this is in the right place. And there's a few ways I can do that. One way is by x-ray. Another way is we're going to auscultate to make sure that we have it in the right place. So I'm gonna grab my stethoscope and take my irrigation tray and pull back, use my syringe and pull back no more than 10 mLs of air, okay? You want to hook your syringe in the clear part of your tube, okay? This blue part is an air vent. It's not for auscultation of checking for placement, okay? And then I'm going to put my stethoscope over the abdominal region, and I'm going to push the air inside this tube, and once I do that, I should hear through my stethoscope a swishing noise. Okay, so I'm going to do that. Alright, and I was able to auscultate and hear the appropriate noise. Okay, while that tube is still attached, I'm going to aspirate, and I'm looking for GI contents. Okay, and I'm going to aspirate enough so that I can check the pH of the contents to determine if I am in the stomach. Okay, and what you can do is just clamp that off so that it doesn't spill out. And I'll take my little strip, put my GI contents on my strip. According to my protocol, I'll follow my protocol to determine if that's the correct pH for the patients. Okay? All right. So what I have left, I'm going to give that back. And then we'll flush it all the way through. And you just need no more than 20-30 mLs of saline. Okay, so I'm gonna flush. All right. So my doctor's order is to do this to low wall suction. So I have my suction. I'm going to turn my canister on and turn to low wall 80 to 100. About the yellow is where you want your gauge to be. Okay, so I got that ready to go. I'm going to check for my pressure. Okay, and then I will connect an adapter to my suction so that I can attach it to my NG tube. Okay. That goes in the NG tube. Okay, and you should start seeing GI contents coming out. Alright, and then last but not least, I'm going to secure my NG tube to make sure that the tube doesn't accidentally pull out. And the way you can do that is take a piece of tape, wrap it around the tube, and then you will have a safety pin. Poke through the tape and then attach it onto your patient's gown. And that way, if the tube has any pulling, it's going to pull on the gown versus pulling up here. Okay? You doing okay, Miss Dan? Alright. So, I'm going to get you back settled. Also, I'm going to note how much output my patient has and document it. Color, odor, consistency, and amount. Also, since she has an NG tube, I don't want my patient's head of the bed any lower than 30 degrees. So I'm going to lay it back just a little bit and make sure that she's at least at 30. Let's just keep you in there. That's about 50. Okay? Alright. Clean up my mess. Let's give you your call light. I'm sorry, I had to reach over you. Alright, call lights in reach. My bed rails are up.